Well, our nursing home crisis is now escalating to the point of legal action. Channel 9 is going over tonight what looks to be the very first lawsuit filed on behalf of a resident at a facility that's dealing with an outbreak.
And attorneys are telling us that more lawsuits like this are likely on the way. Residents have been dying in nursing homes across the state, including one at the Social in Cotswold, at least 5 more at Five Oaks Rehab in Concord, and another resident died at Autumn Care in Cornelius. But this new complaint was actually filed in Rowan County against the owner of the Citadel in Salisbury. Rowan County is not releasing the number of deaths in specific facilities there, but it does say that there have been 16 deaths in congregate care facilities. The Citadel does have 102 total cases. Channel 9's Tina Terry has been following this outbreak since the very beginning. And Tina, tell us more about this new lawsuit and the claims it contains.
Well, yeah, Erica, that family says the Citadel and the owners of the Citadel really should have done a better job at preparing for this virus. Instead, they say that they failed, leading their 96-year-old family member to contract the virus. Family members say 96-year-old Marjorie Fuller Garvin moved to the Citadel in Salisbury this year, paying thousands every month for a private room. But April 8th, she called her son concerned.
She was confused because they had moved her to a different part of the facility where there were other people who seemed sick.
This complaint filed in court yesterday by her family says Citadel staff had moved Miss Garvin from her normal room to an apparent quarantine hall. It says her family and friends were not told anything.
They tried calling the facility staff and they weren't able to get an answer.
Eventually, they say staff told them she was moved because she had a urinary tract infection and not because she tested positive for COVID-19.
She had a private room. That's safer.
The claim says Miss Garvin eventually tested positive for the virus, and family members believe negligence and reckless conduct by the defendants, compounded by a lack of funding, staffing, intervention, or oversight, moved Miss Garvin to the quarantine hall with infected COVID-19 residents without adequately assessing or confirming her own health condition.
We know for a fact that the company that owns this facility is a very large, very lucrative company in New York, and above all, they should have followed the coronavirus when it was first coming into the knowledge of healthcare professionals.
Today, an attorney for the defendant, Accordia's Health, wouldn't answer specific questions, but said the owners of the Citadel did prepare for COVID-19.
The Citadel has an emergency preparedness plan as required by their licensure, and also implemented a COVID-19 pandemic plan. Both plans were reviewed and implemented well before any signs of the virus were known to exist at the Citadel.
Yeah, the CEO for Accordia's Health here has told us just on Monday that this hit like a freight train and there was really nothing they could do to prepare for all of this. As for Miss Garvin, she is still in that facility, we're told, recovering from all of this, and we'll certainly keep you posted. Back to you.
Yes, and also I know you'll keep us posted on the outcome of that litigation. Thank you, Tina. The state is now reporting outbreaks in 39 different nursing homes and 14 residential care facilities, and the numbers are growing even more concerning. 87 people have died in North Carolina nursing homes. 22 have died in residential care facilities. Now the federal government is starting to take more action and requiring nursing homes to report COVID-19 cases directly to the CDC and to the families of residents. The new regulation says that nursing homes can be fined starting at $1,000 if they don't comply.